Hello and welcome to the second episode of the Hep C Later podcast series. My name's Deanne Birch and I'm the programme lead for Hep C Later. We're commissioned by NHS England, funded to provide resources, best practice and training around hepatitis C to healthcare professionals, with the aim of ultimately aiding the elimination of the virus. This podcast continues to highlight the work of partners across the National Elimination Programme, and today we're talking to Sam Uveges, Specialist Pharmacy Technician for Hepatitis Homecare at Nottingham University Hospital NHS Trust. Great to meet you, Sam. Tell us about you and your role in eliminating hepatitis C.
Hi there, so my name's Sam Uveges. I'm the Specialist Pharmacy Technician for Hepatitis Homecare and I'm based out in Nottingham and I work with the Nottingham ODN. So my role basically covers, mainly as the title says, home care. So I look after the patients that are receiving their medication for us via our home care pathway. So basically what that means is that patients who wouldn't necessarily want to be coming into hospital to pick up their medications, or who would otherwise find it difficult to travel to hospital, we provide the medication directly to them. This goes through our internal delivery service and is delivered by drivers that are employed by the pharmacy company that I work for, which is Trust Pharmacy. On top of that, I'm in charge of ordering the stock and obviously managing when the deliveries are going out, so ensuring that patients are getting these at the right time, within the right time frames, and also that they're not running out or running short at any point. So that's kind of my pharmacy aspect of the role. Aside from that, obviously I do work for the ODN, so I do work around tracking of blood. So when the patient's due for their final SVR test to tell us whether they've cleared the virus or not, I look after all the monitoring and managing of that. And also I'm involved with project work, so I've got a feedback project running at the moment, so we're also looking to see how we can improve on that service, how we can do better for our patients going forward. And also I'm involved with a outreach project which looks at utilising community pharmacies as a way of getting patients tested with the view to then eventually getting them treated.
Sam, that's great to hear that you're involved in so many areas of patient care for Hep C. So tell us about the project that you're currently running to find and treat patients with Hep C through community pharmacies across Derbyshire and Nottinghamshire. Where did the project start and how did you approach pharmacies or encourage them to be involved?
So the community pharmacy project started off the back of the NHS England project, which was launched in 2020, where they were asking community pharmacies to offer testing to patients who were on OST, so buprenorphine and methadone patients. The challenges with that project was, for one, when it was launched. So it was launched back in 2020, and as we all remember, it was not the best of times to be launching anything, let alone with everything else that was going on in the world. And the other challenges around that was there was difficulty in obtaining the necessary equipment to be able to do the tests, and as a result of that, the uptake wasn't fantastic. And I don't think, certainly from Nottingham's perspective, we had many, if any, referrals from that system. So what we did is, using that model, we looked at how we could use a similar model but also change it to make it more suitable for the pharmacies. So where I kind of come into that is, as a pharmacy technician, I can say, well, the pharmacies are going to be maybe keen for this, but it's additional work that they've got to do. So what we did differently is, using that same model still, we're going to the pharmacies and saying, this is what we want to do, i.e. we want to offer a test to all of your patients that are on OST, but we're not asking you to do any work, we're going to do it all for you. And that's kind of the big selling point, is that the pharmacy doesn't have to do anything additional other than let us through the door. And that's where this has been quite successful, because, as I've said, obviously pharmacies are extremely busy. They've got a million and one things going on in the back with all the prescriptions and all the other additional services that they've got to do. And for you to then add in another thing for them, but unless it's something that they're particularly passionate about, or that they're going to see a big financial gain from, they're not necessarily going to be as willing to go for that. Where we come in and make that big difference is, as I said, we're doing the work for them. So all they've got to do is let us in into their consultation room, and then we do it all for them. They can carry on as normal, they can do what they need to do, and we just crack on with our work. The only thing we ever ask of them on the day is, when their patients come in to pick up their medication, can they just point them in our direction so that, we know who they are. And it's been really successful because of that, because, as I say, there's no additional pressure on them. We're getting to do what we need to do, and it just works all around, really.
Well, that seems like an ideal approach, actually. Keeping the ask from the pharmacies minimal whilst they're busy juggling the workload and providing you with access to those most at risk. So, how did you then look at incentivising testing for those who might have been reluctant to test?
So incentivizing wise, so for the pharmacy, we incentivize by saying, we're not asking you to do any additional work. That always goes down well. We also offer a CPD session as well. So as pharmacy technicians and pharmacists, we are registered professionals. We have to keep up a portfolio of development. So I offer a bespoke session on that, which is tailored to what the pharmacies would need. And I've delivered that to vast majority of the pharmacies that I've been to, in some way, shape, or form, whether that's with the whole team or just select members of the team that have got that got their registration coming up or something like that. But that's something that we offer for them as something really different. We offer that they can come and shadow us if they really want to. We've had a couple of, say, pharmacy students have come and sat with us for an hour or so when we've been doing testing, obviously at the patient's discretion, that is. But we've had people come and do that with us. We've had people come and actually have a test because they've wanted to do it. And so it's been really great from that score. And for the patients, we do offer incentives for them as well. So any of the patients that present who are on prescription for the OST, we offer them a £5 Love to Shop voucher. Always goes down a treat. Any members of the public who come in, or any of the pharmacy staff, we don't generally offer incentivization for them, because if they've kind of come in off their own free will, we don't really see that there's a need for that. However, there have been the odd occasions when we have done that, and yeah, the project's run really well. It's been really successful. So to give you some facts and figures, over the course of the events that we've done, which is a total of 21. Yeah, so we've done 21 so far. And out of that, we've performed 252 tests. We've received back 51 of those have been antibody positive, and 13 have been RNA positive. And so once we've done that, obviously we get back in touch with them. We'll refer them through the regular pathways and everything. So a nurse will be in touch, and they'll do any additional tests that we need to do, any fibre scanning, for example, things like that. So of those 13 that have been positive, 10 have now been referred for treatment, and 8 have actually commenced onto treatment, which is absolutely fantastic. And again, of those 8, we actually now have 3 patients who have achieved an SVR, so they're clear of the virus. So it's been really brilliant. Of the 13 that we found, there's been reasons, obviously, why 3 of them hadn't been referred in for various reasons, and again, various reasons why only 8 of them have commenced. But even still, from a percentage point of view, of the people that we've had positive, the vast majority have now gone on to treatment, and I'm hoping that we will start seeing some more SVRs coming through within the next few months, because there would be a few now that would be due for that. So hopefully we'll see some more negatives coming through very soon.
Well, those results are fantastic. They kind of quite show really well how the project is really making a difference in your area, don't they? So this is a really exciting project that you're leading the way on within pharmacy practice. Hopefully this can be used as a model by other areas across England. So what would you advise to pharmacies who would be keen to get involved in a testing event?
So my advice to pharmacies who want to get involved with this, or want to start doing testing events, would in the first instance be find out who your local ODN are, and just get in touch with them, find out how what projects are they running? Are they doing any community work in pharmacies at the moment? And just say we're really keen to get involved with this. We've got a number of patients that are in receipt of a blue prescription, and just see how you can help. Even if you can't do a testing event as such, there's other things that are going on at the minute. So one of the other big national campaigns at the minute is around the Test and Treat portal, which is been launched by NHS England. So what that is, it's very similar to the old COVID tests, where you go online, you register, and you have a test sent to your home. It's all discreet. It's all completely confidential and everything else. So your data isn't necessarily shared with anybody other than the company that runs the testing. So it's a company called Preventex. So what you do is you get the test sent to your home. You take the test, send it back off. It goes to the labs as it's tested, and then your results are sent back to you via text as long as it's negative. If it comes back positive, then it's referred to the ODN, and then you'll receive a call from somebody within the ODN that will then talk to you about your treatment and what the plan is for your treatment going forward. So it's a fantastic little thing, and one of the big things we're trying to do at the minute is just get pharmacists to start promoting that for us, as well as all the other campaigns that we've got going on at the minute. So particularly in Nottingham, we've got a bus campaign running where we've got posters up on the public transport for around a month, maybe two. We're looking at other places as well, so we've been around our sort of local areas and dropped in at dental surgeries and GP practices, places like that would see a big footfall of these patients. Can we get posters up? We're looking into other areas as well, so like the local football teams and things like that. We're trying to see if we can approach them to get some advertising going as well. But aside from that, pharmacies are a big, massive help for things like that, because of the amount of footfall that they see. Even if it's just their regular, patients that come in and pick up every couple of weeks or so, it might just be that the patient spots that poster and has a think and goes, oh well, I had that piercing done when I was abroad, about 10 years ago. Maybe I should get myself tested. It all adds into it, and it all helps towards that spreading of the awareness, and raising that awareness of hepatitis C and what your risk factors are, and the ways in which you can catch Hep C. So even if a pharmacy can't necessarily offer that, if they could just offer to pop a poster up with the QR code that can be scanned, that would be absolutely fantastic. If they're really keen for obviously getting people in for to do a testing event, then your ODN would certainly be able to offer support with that. We're all very keen on testing, and we've all, pretty much most of us, will have done a testing event of some description. So we would certainly be able to work with the pharmacies to build something on that, absolutely.
Wow, that's a really comprehensive awareness campaign you're undertaking. I would just add that Hep C Later has resources that we can provide to healthcare professionals, particularly GPs, pharmacists, and dental practices, to advertise the national testing portal, and that includes a poster with a QR code linking straight to the portal. So if you're looking for a quick, easy way to direct people to the portal for a hepatitis C test that they can do at home, please take a look at hepclater.com/resources, or email us at connect.hepculator@mpft.nhs.uk. With any new project, there are key pieces of learning that we make. So what did you learn after running your first few events?
So one of the key things we learned was that when we were offering the vouchers to incentivize for everyone, we would get a lot of people that were coming for the test, obviously purely just to get the vouchers. Now, we did an event out in Sinfin, one of the very early ones that we did, which is up in Derbyshire, and what we were finding was we test a patient. Let's say we tested a patient. They would then get on the phone and ask their husband or partner or whoever to come down and get a test. They'd turn up half an hour later. Then, later on, we'd then see that patient's brother and then their partners and then the siblings, and it just grew into one of those like big family things. And I think at one point we had a family of about 5 or 6 that had all come throughout the day for a test to get a voucher off us, which is absolutely great because it put my numbers up, which is absolutely fantastic. The downside was that they didn't necessarily have a risk factor or weren't necessarily within one of the high risk groups. So, I mean, it wasn't a waste. Don't get me wrong. No test is ever a waste, but it was kind of the point where we thought, okay, maybe we need to rethink this strategy a little bit, because we were obviously spending a lot of money on the tests and doing the tests, and then obviously the additional £5 on top of that on the voucher. And we just had to think, well, if we get this at every event, it's not going to be sustainable for us. So what we did then is we kind of changed tactic a little bit. So we then only offered the vouchers out to patients that were in receipt of a blue prescription, or any patient that we felt was in need of the voucher for some other reason. And it's certainly seen a bit of a decline in the number of people we have coming for tests, but the upside has been that we know that the people that we are testing have a risk factor, and are the people that we would be trying to target. That's not to say that we don't invite everybody for a test. So if somebody was in the pharmacy, saw the posters, saw us around and said, "Oh, what are you doing here?" and we spoke to them and said, "Oh, I'd like to come for a test," we're not going to discourage them from coming for one. We would still do the test absolutely 100% willingly. The difference being is, you've come here of your own free will, so I don't necessarily need to incentivize you to, have a voucher from me as well. That was the main thing that we learned, and then on top of that, it was just general learning of how to approach patients, how to have that initial conversation, and generally just try not to scare people as well. I mean, you talk about things like bloodborne viruses, and I suppose everybody knows, everybody knows about HIV, they know about hepatitis B, but Hep C is kind of that one that's not as well known, so trying to give that little bit of education whilst they're there, without trying to put them off from actually coming for treatment should we find out that a patient is positive.
I definitely agree. From our experience with engaging the drug and alcohol services, that knowledge of Hep C amongst the public is generally quite low, and helping to create that understanding of the risks especially is just so important. So our final question to you, Sam, then would be, where do you hope to take this project in the future? And is there anyone in particular that you want to highlight? And we know across the National Elimination Programme, there are so many different partners we work with day to day in the NHS.
So my big kind of hope as to where to take this project in the future is, I'm really quite keen to grow it as much as possible. So the last sort of phase I've been working closely with 2 large-ish chains in particular. So that's Peak Pharmacy, and we've done some testing around Nottingham and Mansfield areas. And then the other chain I've been working with is the Lincolnshire Co-op. Now both of those have been absolutely fantastic. They've really helped us in regards to getting this project off the ground and getting into places. The initial phase we did was just with sort of smaller chain pharmacies and independents. Again, absolutely fantastic. They were brilliant. They really helped us set this up and get this going. So just to name them, that was we did the pilot with my pharmacy over at the hospital, so that's Trust Pharmacy. There was Evans Pharmacy in Newark, Wilson's Pharmacy out in Sinfin, Dean and Smedley's in Mackworth, the Plessley Pharmacy, and D Palmer Pharmacy, which are based in the Meadows area of not Meadows, the St Anne's area of Nottingham. Again, all absolutely fantastic, brilliant. Cannot thank them enough for their work and their support with the project. They were all absolutely fantastic to start that point off, and to certainly that's where we did the majority of our learning, was in those small chains. the mid chains, so Co-op and Peak, again, fantastic. Cannot thank them enough. They've been so supportive and so brilliant with getting this off the ground, and even pointing us in directions of where else we can go with the project. So off the back of that, we've spoken at Nottingham's local pharmaceutical committee, and we've pitched the project and the portal as well with them, and some of them took that massively on board. They took the posters away from them. They are now up in their pharmacies. They're looking at how they can spread that word out of us through Nottingham, and we're waiting on a date at the moment to go and do the same at Lincoln's LPC as well. So, you know, fantastic from that perspective, just offering us that bit of insight. Personally, I've only ever worked in hospitals, so community is kind of a little bit alien to me, and you know, for them to be able to offer up their services as well as everything else has been amazing. The future for me would be to get into one of the, you know, the big chains that covers national, you know, and I am currently in conversation with one of those chains to try and get this off the ground and try and get that started. I've had some fantastic conversations with the superintendent over in that chain. I do know her personally as well. I used to work with her a few years ago, which has been a massive help. But they, again, you know, we're very, very close to getting that off the ground, or I hope we're very close to getting that off the ground. And I think once we do that, that's going to massively aid us in the fact that we can use some of their pharmacies that are out in the hard to reach areas, particularly like, you know, rural Derbyshire and things like that. We know of a few stores that are in those places. And on top of that, it's just how can we work just using that pharmacy as a base to go to that area and say, right, okay, so we're over here, so what can we now do whilst we're there? So maybe on the first one we go out and do a load of testing, then on the second time going out we say take a FibroScan with us and offer FibroScanning to any of the patients that were positive. You know, there's no reason we couldn't do that within the consultation rooms. And on top of that, just having that base in those areas is just what you really need. Like, you know, I mean, it's okay going to do house visits and everything else, but if you drive out all that way and then find out that patient's not there for whatever reason, you know, that can obviously cause time aspects and everything else. So being there for the day and having that base to say, okay, so we're in this area, but we know we need to go and see this patient and this patient. Well, we're there anyway, so that's a 10-minute trip from that pharmacy instead of a 2-hour trip from the hospital, for example. And things like that have just been absolutely fantastic, again, whilst we've been doing the current project. So the massive hope with that is that if we can get into these larger chains, we can start looking at these more rural places and these areas that we don't necessarily get ourselves into that easily, and see if we can start picking up these patients from those areas. And that is my massive hope for this. And I'd hope that, you know, nationally we can get something like this off the ground, even if the, you know, if the ODNs aren't necessarily doing the work themselves in the future and it is being run by the pharmacies. You know, just to see that take off would be absolutely amazing. As a, you know, as a pharmacy technician and everything else, I'd love to see pharmacy progress into that. And certainly I think that there is a massive opportunity for pharmacies to be at the forefront of helping us to you know, to help eliminate Hep C from the UK.
Yeah, conversations with the national chain sounds very exciting. I really look forward to hearing where that leads in the future. Thank you very much, Sam, for getting involved in the podcast and giving us an insight into the work that you're doing within community pharmacies. So for anybody else out there listening, if you'd like to know more about this programme or how you could get involved, drop us an email at connect.hepclater@mpft.nhs.uk and we'll put you in touch with your local operational delivery network team to get you started.